Hello, I'm Dr. David Thompson. Before we dive into the science, I want to tell you about a woman named Martha. Martha was 64 years old, living just outside of Chicago. When she first came to my office, she wasn't walking. She was being pushed in a wheelchair by her daughter. Her orthopedic surgeon had told her she was bone on bone. He said her knee cartilage was erased like a pencil marker, and if she didn't get a double total knee replacement immediately, she'd spend the rest of her life in a nursing home. Martha was terrified. She didn't want surgery. She feared the anesthesia, the months of painful rehab, and most of all, she feared becoming a burden. She felt like a car with 4 flat tires, stuck in the garage while life passed her by. Today, Martha is 66. She doesn't use a wheelchair. She doesn't even use a cane. Last autumn, she sent me a photo of herself hiking the Great Smoky Mountains. How did she do it? It wasn't a miracle drug. It wasn't a breakthrough $10,000 injection. It was a simple, targeted shift in how she started her day. We used a natural biology-based method to feed her joints the specific raw materials they needed to repair. 97% of doctors overlook this because they are trained to manage symptoms with pills, not to regenerate tissue with nutrition. But today, I'm going to show you exactly what Martha did. I'm going to guide you through the specific breakfast foods that can help you regenerate your knee cartilage and reclaim your independence. Before we go any further, I want to get to know you. If you're watching this, you're likely feeling that nagging ache, that click when you stand up, or that stiffness that makes the first 10 steps of the morning feel like walking on broken glass. Please, stop the video for a second and comment below with your age and your primary symptom. Example, 55, sharp pain when climbing stairs, or 42, stiff knees after sitting at my desk all day. I read these comments, and they help me tailor these videos to your specific needs. I want you to hear this clearly. Your pain is not just genetics. It is not an inevitable sentence of aging. In my 30 years of practice, I found that joint decay is almost always driven by a deficiency in 4 specific joint regeneration nutrients. When these are missing, your body literally cannot build new cartilage, no matter how much you rest. For those who are new to the channel, welcome. I'm Dr. David Thompson. I've spent over 3 decades in the trenches of clinical medicine, treating thousands of patients who were told their only hope was a prescription pad. My mission is simple: to help you stay out of the operating room and off the pharmacy lines. I believe in science-based sovereignty, the idea that through rigorous nutrition and biological understanding, you can take command of your own healing. You deserve to live a long, mobile life without being dependent on chemicals. Are your knees actually rotting, or are they just starving? Let's find out. I want you to count how many of these 5 symptoms you've experienced in the last 30 days. 1. The morning rust. Do your knees feel stiff for more than 20 minutes after you wake up? 2. The stairway warning. Do you feel a sharp pinch or a dull ache specifically when going downstairs? 3. The popcorn effect. Do you hear audible cracking or grinding sounds when you squat? 4. Weather sensitivity. Do your knees predict the rain by aching when the barometric pressure drops? 5. Post-chair paralysis. After sitting at a desk or in a car for an hour, is your first step excruciatingly stiff? How many did you get? Comment your number, 1 through 5, below. If you scored a 3 or higher, your joints are likely suffering from oxidative ischemia and chronic microinflammation. Think of your cartilage like a sponge. When it's healthy, it's full of water and nutrients, bouncy and resilient. But when you have these symptoms, the sponge has dried out. It becomes brittle and starts to crumble. The root cause isn't wear and tear. It's that your body's cleanup crew, autophagy, has stopped working, and your repair crew, chondrocyte, has gone on strike because they don't have the materials to work with. Today, we are going to end that strike. The first thing I want you to consume, ideally on an empty stomach, is high-quality, long-simmered bone broth. Take Arthur, a 58-year-old construction foreman. His knees were so swollen he could barely climb a ladder. He was taking 800 milligrams of ibuprofen 3 times a day just to get through his shift. We put him on the liquid gold protocol. Within 21 days, the swelling had subsided so much he could drive his truck without that throbbing sensation in his legs. Cartilage is made of a matrix. Think of it like a brick wall. The bricks are your cells, but the mortar holding it all together is type 2 collagen. Bone broth is packed with glycine, proline, and hydroxyproline. These aren't just proteins, they are signaling molecules. When you drink bone broth, these amino acids act like a specialized delivery service, heading straight to the synovial fluid in your knee. Glycine, in particular, acts as an inhibitory neurotransmitter that reduces the pain signals coming from the joint while providing the raw materials to patch the holes in the cartilage matrix. A landmark study published in the journal Current Medical Research and Opinion, 2008, followed 147 athletes with activity-related joint pain. The group taking collagen hydrolysate, the active component in bone broth, showed a significant reduction in joint pain compared to the placebo group. It wasn't just a feeling, their joint integrity actually improved. Practical guide. The recipe: use grass-fed beef bones or organic chicken carcasses. Simmer for 12 to 24 hours. The golden secret: you must add 1 tablespoon of apple cider vinegar to the pot. The acidity helps leach the minerals, silicon, magnesium, and calcium, out of the bone and into the water. Dosage: 8 to 10 ounces every morning. Do not buy the powdered versions with artificial sweeteners. They lack the gelatinous structure your knees crave. Have you ever tried making your own bone broth, or do you find the smell a bit much? Let me know in the comments. Next, we need to address the fire in your joints. Sarah, a 52-year-old office worker and recent grandmother, suffered from postpartum delayed inflammation. Her hormones had shifted, and her knees felt hot and puffy. She felt like she was 80. We started her on a specific golden scramble for breakfast. In 4 weeks, she was back to playing on the floor with her grandson. Inside your knee is a protein complex called NFKB. Think of it as a master switch for inflammation. When it's flipped on, your body produces enzymes that literally eat your own cartilage. Curcumin, from turmeric, and gingerol, from ginger, are nature's most potent switch flippers. They enter the cell and flip that NFKB switch to off. It's like having a tiny fire extinguisher inside your joint capsule, putting out the microscopic sparks before they turn into a forest fire of pain. In a 2016 meta-analysis published in the Journal of Medicinal Food, researchers found that standardized turmeric extract was just as effective as ibuprofen for reducing pain and improving function in patients with knee osteoarthritis, but without the stomach lining damage or kidney risk. Practical guide. The recipe: 2 organic eggs or silken tofu, 1 teaspoon of grated fresh turmeric, and 1/2 teaspoon of ginger. The absorption rule: curcumin is fat-soluble and has low bioavailability. To make it work, you must add 2 things: a healthy fat, like avocado or grass-fed butter, and a pinch of black pepper. The piperine in black pepper increases turmeric absorption by a staggering 2,000%. Golden time: best eaten between 7 a.m. and 9 a.m. when your body's natural cortisol levels are rising. Do you like the taste of turmeric, or do you find it too earthy? I'd love to hear how you season your eggs. This is what I call the shield, because it protects the cartilage you still have from further rusting. George, 71, was a retired postman. His knees felt crunchy. He described it like having sand in his joints. We added a bowl of fresh pomegranate seeds and raw walnuts to his morning routine. Within 2 months, the crunching sound, what we call crepitus, was reduced by nearly 60%. The sand George felt was the result of oxidative stress. Imagine your joint is a piece of metal left out in the rain. It begins to rust. In your body, that rust is caused by free radicals. Pomegranates contain elagitannins. When you eat them, your gut bacteria convert them into a miracle compound called urolithin A. This compound triggers mitophagy. It cleans out the old, dying mitochondria in your cartilage cells and replaces them with brand new, energetic ones. The walnuts provide alpha-linolenic acid, ALA, which acts like a protective oil coating the cells against oxidative rust. A study in the Journal of Nutrition, 2005, demonstrated that pomegranate fruit extract inhibits the enzymes that break down cartilage, specifically matrix metalloproteinases. Essentially, it acts as a biological shield that prevents the enzymes from biting into the cartilage. Practical guide. The recipe: a half cup of fresh pomegranate seeds, arils, and a handful of raw, unsalted walnuts. Combinations: mix them into some full-fat Greek yogurt, if you tolerate dairy, for added vitamin K2, which helps direct calcium into the bones and away from your joints. Note: avoid pomegranate juice that has added sugar. High sugar triggers insulin spikes, which actually increases joint pain. Stick to the whole fruit. Have you noticed your joints feeling worse after eating sugary foods? Comment "sugar" if you've felt that connection. Finally, we need to change the oil in your joints. Elena, 45, an office worker, was developing early-onset stiffness. She lived on coffee and bagels. Her joints were dry. We replaced her bagel with a sardine smash on sourdough or a chia seed pudding for a plant-based option. 3 weeks later, she told me, "Doctor, I feel like someone finally greased my hinges." Your joints are lubricated by synovial fluid. Think of this as the engine oil for your knees. If your diet is high in processed vegetable oils, omega-6, your oil becomes thick, gritty, and inflammatory. By consuming high doses of EPA and DHA, omega-3 fatty acids, in the morning, you are performing a biological oil change. These fatty acids replace the inflammatory fats in your cell membranes, making the fluid in your joints slippery and smooth again. The Journal of the American College of Rheumatology has published numerous studies showing that high-dose omega-3s significantly reduce joint morning stiffness and the number of painful joints. Practical guide. Option A: the powerhouse 3 to 4 wild-caught sardines on a slice of sprouted grain toast. Sardines are also rich in vitamin D3 and calcium, which are essential for the subchondral bone that supports your cartilage. Option B: the plant-based route: 3 tablespoons of chia seeds soaked overnight in almond milk. Golden time. Morning is best because it sets your anti-inflammatory tone for the rest of the day. Pairing. Pair with a squeeze of fresh lemon. The vitamin C is a necessary cofactor for collagen synthesis. Without vitamin C, your body can't knit those collagen fibers together. Be honest. Could you handle sardines for breakfast, or are you strictly on Team Chia? No judgment here. To recap, if you want to stop the bone-on-bone slide and start regenerating your knees, your breakfast should focus on 1. Bone broth for the mortar. 2. Turmeric and ginger to extinguish the fire. 3. Pomegranate and walnuts to shield against rust. 4. Omega-3s for a biological oil change. You can eat all these foods, but if you're still washing them down with a sugary soda or a pastry filled with cartilage-killing soybean oil, you're taking one step forward and two steps back. Your body wants to heal. You just have to stop standing in its way. I've seen patients go from fearing the wheelchair to walking their daughters down the aisle, all because they decided that old age wasn't an excuse to stop nourishing their cells. If you found this helpful, please subscribe to the channel and hit that notification bell. In our next video, I'm going to reveal the 3 bedtime drinks that can actually help repair your joints while you sleep. You won't want to miss that. I'm Dr. David Thompson. Keep moving, keep nourishing, and remember, your health is in your hands and on your plate. Would you like me to create a 7-day printable shopping list based on these breakfast foods to help you get started?